Everybody has bad habits. And so when it comes to lower back pain or neck pain, it's the repetitive habits we have.
This is Dr. Meenal, and welcome to Uncover Your Eyes, where we uncover reality. As a mom and eye doctor, I want to know it all. It seems that pain has pretty much taken over my life, whether it's knee pain, leg pain, arm pain, feet pain, lower back pain, upper back pain, neck pain. I don't know if it's after having kids or is it me getting older or is it as a healthcare provider just my ergonomics or is it my lifestyle at home, my day-to-day things that I'm doing? I have no idea, but I feel that pain is starting to dominate a large part of my life and I do think about my pain every day and more often now. So today I have with us someone who's here to help myself and you guys understand how little changes in our life can help manage our pain or even cause pain if we're not making these changes. So today I have with us Dr. Pawan Sabharwal. Dr. Sabharwal is a chiropractor in Toronto and the owner of My Chiro Mobility. He brings the clinical experience to patients' homes and offices. He does this to assess their environment and help eliminate their daily physical stressors. Welcome, Dr. Pawan Sabharwal. So, thank you, Dr. Pawan Sabharwal, for being on today. It's such an honor. Thank you.
Thanks for having me. This is great.
Yeah, absolutely. So, back pain seems to be the thing of our lives now, right? So
Absolutely.
tell me, how is back pain restricting or affecting our daily lives?
I mean, it restricts us in so many ways, and one of the main reasons why we do feel back pain or any kind of pain in the body is because of our repetitive strains on a daily basis. Everybody has bad habits, and so when it comes to lower back pain or neck pain, it's the repetitive habits we have, whether it's lower back and we're bending down repetitively or twisting to one side all day, whether it's at work, taking care of your kids, whatever it could be. So that's one of the main things that restricts lower back pain. Even a big thing is not stretching. There's many people out there who work out, which is wonderful, but they don't think about stretching
Right.
afterwards. And so the tighter the muscles get, that's what pulls the joints out of place. And at times can create something like that ongoing like stiffness in the lower back, or God forbid, you throw your back out and that's when your back seizes up and you're on the floor and
Right.
now all of a sudden you just can't go about your day. And it's kind of like when the body says, you know what, I think we've had enough. You're not listening to the signals I'm giving you that you don't need to keep doing this repetitive movement over and over. We're going to seize the body to allow it to heal, which
Right.
is so interesting. Yeah,
And it's interesting because it's like, yeah, like you said, we don't listen to our body. We keep going because we still have to go to work. So we just ignore it. We move on. I mean, some of us will wear a back belt and just, get through our day, but we ignore it until it gives out, I guess. How
yeah.
does that affect our mental health? Because I'm assuming like when we're in a lot of pain, that's affecting our well-being as well.
Absolutely, right? I see many patients. One of the most common patients I see in my practice, when we're going to people's homes or offices, it's when it gets to that level where you've thrown your back out and you're like, oh my God, I need help. I can't go about my day, especially if you have small kids at home. You have a baby at home, you have to get to work, and maybe you're the person that's the main driver of that work day. And if
Right.
you're derailed, you can't function. So I mean, it
Right.
does affect your mental health overall as well, especially if you're somebody who's go 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 and has never dealt with something like this before. You
Yeah.
know?
Right.
It can be anything from your fitness journey. You've worked so hard to get you where you are, and now you've been derailed by a back injury or a shoulder injury, and now all that work you've put into it, now you have to step back months behind, and now you know heal yourself and then get back up on that horse and start working out again.
Right.
It's the same thing with those that are working all the time. If you have a job that requires a lot of physical strain, repetitive strain, whether you're a nurse, whether you're a dentist, somebody that's working in an office constantly using the mouse, looking at one monitor over and over, all these habits increase that tension. And so when we're derailed by an injury like this, it can affect our mental health quite a bit because we're like, well, what am I going to do now? The first thing
Yeah.
is stress. How am I going to pick up my baby? How am I going to meet this deadline for work? So it becomes this whole mental habit as well. But with the mind body connection, it's very it's a really cool connection because what ends up happening is our body is sending us signals every day, telling us, hey, and it tells us it doesn't like something through pain, through tightness. And if we keep ignoring it, what ends up happening is those muscles get tighter and tighter, and then you're out of
Yeah.
commission. And that's when
Yeah.
the mental stress comes in. A common conversation I've had with patients, if I use the example of throwing your back out, it never happens at the right time.
Yeah.
There's never a right time
There's
for
no
it,
right
but
time.
you'll
Yeah.
know. But what happens is almost every single client I've seen, it's when they have the highest stress, whether it's work stress, mental stress.
Right.
And so when you have a lot of mental stress, what will happen is your mind will throw that stress to a body part. And usually it's the body part that you've had injuries in before and you're more susceptible to, whether it's migraines, the shoulder pain that keeps coming back,
Yes. Yeah.
the lower back pain, for example. So mental health is a huge aspect of
Right.
this, and
Yeah.
many
Yeah.
times with my clients, I like to couple the treatments with a psychotherapist or somebody in mental health that can help them alleviate mental strain as well. So there's a
And
big
I think for us,
correlation.
like, I also feel when I'm in that pain, and obviously if it gets to that point, then it's like we have to work on cutting down our schedule, and then that can also be stressful because we feel like, oh my God, we're not seeing as many patients, or we're not accommodating, as many people, and we're not making that money, or we're not able to, for the breadwinners of the family, whatever the situation is, it just piles on, and then there's more stress, and then there's more back pain, right?
Yeah.
So it becomes a vicious cycle for us as
It's a
well.
chain reaction effect, right? So, uh, and what I tell my patients after they've, recovered from this is in the future, just be mindful whenever you're having a stressful time, whether it's emotional or with work, be mindful of that lower back. It will start to tense up. Be mindful of if you're one that gets headaches with stress, it's going to
Right,
start tensing up. These are signals your body's telling you there's a lot of stress. I need you to calm down. I need you to take a break.
right.
Right.
So
Yeah.
why are, like, because I've noticed, younger and younger people coming in complaining, or people even I meet, my friends, complaining of body pain, or back pain is probably the most common. Why is it happening? It's at a younger. I mean, there were healthcare providers back in the day as well. So why is it happening at a younger age? Do you feel?
I think there's two ways of looking at this. One is we know that we live in a technological world where from the age of single digits, your child knows how to work a tablet, knows more about YouTube than you do, and whether we're doing that, working on an office on our phones, we're always hunched over. This is affecting our posture over time, you know.
Right,
And what I've noticed is I'm starting to see more and more teenagers as patients because the parents are concerned of that hunched over kind of
right.
posture, and if they can,
I feel like I have to straighten up
adopt,
talking to you, by the way.
right. If they can adopt healthy habits at a young age, then going into your 20s, 30s, you have a better grasp on how to take care of yourself. How do you hold yourself up? Okay, maybe I shouldn't be looking at my phone so much. Maybe I should raise it up a little bit more, right? The other way of looking at this as well is whether it's injuries, whether it's mental health, so many things is I feel that we are the first generation to be more proactive about our health.
Right.
And we don't go through life like maybe our parents did, our grandparents did, suffering through be tough work through that pain and
Right.
keep going, right? And I think many of us are seeing, and even our children are saying that, I don't want to be hobbling around when I'm in my 60s and 70s. I don't want that hip replacement, this and that. And one thing I say to my patients is, it's like taking care of your favorite car. This is the only physical vessel that we live in. It is our responsibility to take care of it. And if we don't, it will breakdown and we have to suffer the
Yeah.
consequences. So
Yeah.
I'm noticing what I'm noticing is it's great is I'm seeing a lot of new patients even in their 20s who've got their
Love
first
that.
job and they have benefits. And one of the questions I ask is, so what brings you in? Many times it's not this huge pain that they're having. They're like, oh, I have a little bit of tension in my neck or my lower back, but it's nothing too bad. I just want to take care of myself because I have benefits now. I'm like, and that's great to hear. I'm like, great. I'm so glad you're proactive about your health. You don't
Right.
have to suffer through life, right?
And I feel like
So,
so many of us healthcare providers do, right? I mean, we're
yeah,
we're preaching to others, but we're suffering silently, and we just get through our day because we feel like we're in need and we need to be there for our patients, but we're not there for ourselves, like you said, respecting our body. But you're right. There's that huge shift in wellness,
yeah,
and health and taking care of your well-being, and that proactiveness that I didn't realize that a lot of people, nutrition wise as well as health
yeah,
wise, fitness, are starting to take care of themselves. So, lower back pain obviously is, I want to say it's the worst pain because I don't know, I feel like it can radiate up and down. So tell me, like, how does that work? Like, why does it radiate down my legs or, up as well for some people, I'm assuming? Why, how kind of thing?
sure. The spine is such an amazing structure, and I like to compare your nervous system, your brain, to the computer in the body. And the nerves that run throughout the body is our computer wiring system. And our spine, you can think of it as the switchboard. At every level, there's nerves coming out at each level, whether it's controlling the function of your organs, your muscles, every sensation we feel from pain to heat to a regulation of our heart, circulation, breathing, everything, right? So when it comes to the spine and we're thinking about things like sciatica, like what you're asking about, like a pinched nerve, it's almost like what happens is many times this again is created by repetitive strain. And we don't know we're doing it until we finally feel that pain and the body says, that's it. So when the spinal structures shift to one side and just happen to touch on an exiting nerve, it's like stepping on a water hose. The information is not going through. And because the information is not going through, now those muscles that nerve controls are panicking. So you'll feel things like
Yeah.
sharp shooting pains. You'll feel things like a pulsating of the muscles just when
Right.
it's located. And when it gets really bad, it can feel like an electric shock down your leg, spasming of the muscles. And what's interesting is many times when people have sciatica, for example, if we're using this example, is they'll say, I don't have back pain. I have this pain in my leg. My back is fine.
Yeah. Yeah.
Right? Isn't that fascinating? But it's because the nerves control the sensation. So if we're pinching down on a nerve, we're only going to feel the sensation that that nerve provides and a disruption in that nerve. Even though it comes from the back, you're not going to feel it. But as I'm treating patients, I let them know that the journey back to feeling better is you're going to notice that now the pain's not going to go all the way down to the toe. It'll go only to the knee, then the upper thigh, then the glute muscles, and then you're going to have a little bit of lower back pain, and then it will go away. So the pain slowly starts to go back to where it originated from as the swelling in the disc or the pinched nerve is reducing.
Wow.
So
Right.
yeah, so that's how those nerves work.
It goes
The body
everywhere.
is an amazing structure. The spine is an amazing structure. So
Yeah.
yeah,
I mean,
yeah,
ergonomically at work, as healthcare providers, I feel like we're always on our feet. We're, like you said, it's a constant bending, right? I do the same thing. I'm on my computer, then I talk to the patient. You're back and forth. You're twisting, I guess.
yeah.
What are some ergonomic shifts that we can make in general as healthcare providers to help alleviate that pain or the possible onset of those spasms, the tightness in the muscles?
Right. I think the first thing is to be mindful of the repetitive movements you make. If I use the example of, let's go into the hospital, we're talking about nurses, we're talking about doctors. You're always, almost always standing to the left of the hospital bed
Right.
and looking down at the patient. So right away, we have this turning to the left,
Mm.
right? And it can be the same thing as the stations, whether it's in your office, whether it's a nursing station, if your monitor's off to the left, it all comes down to starting with mindfulness. Like, what am I doing on a daily basis where I'm turning to one side a lot, right? And you'll notice it the most by the end of the day, or even during the day. You'll be like, wow, the left side of my neck is always tight. What is it? What's going on there, right?
Yeah.
What am I doing on a daily basis? And just making sure you look at your workstation and think, what are my repetitive strains? If we can remove the repetitive strains, we are now protecting ourselves from injury. This can mean something like if your monitor is off to the left, twist your whole body to the left. A big thing is our swivel chairs. They were created to alleviate tension from your neck and lower back, so you're not twisting your body, the chair twists. But
Right.
many times we're just not mindful of it because we're so busy doing the work that we're
Oh, yeah.
doing.
We don't actually
We're not
twist.
thinking, yeah, we're not thinking, how am I twisting from side to side, and
Mhm.
what am I doing at this time? So I think the first trigger to be mindful of your repetitive movements is, what aches and pains are you feeling on a daily basis, right? And the easiest thing to do is, whether it's a monitor off to the left or say your patient's to the left, try to face that person or monitor, whatever you're looking at, head on. What can I do so that I'm facing it head on rather than twisting to one side repetitively, right? Recently, I treated a pediatrician, and she's been dealing with neck pain over and over,
Okay.
and she deals obviously with a lot of children, so she's constantly looking down. So her neck's always bugging her, lower back's bugging her
Mm.
too. So we talked about ergonomics. What can we do, right? They're always shorter. Is there a way where maybe you can have the child sit on the parent's lap, for example, on the examining table, and you have a seat on the stool so that you're facing them head on rather than constantly looking down? The other thing we realized was she always has her stethoscope around her neck. And it's, even though it's such a light weight,
Yeah.
for hours after, it drags down the neck as well. Can we put it in the lab coat, for example, or set it down on the side to just give yourself a break? Um, when it comes to your doctor or nurse looking at the patient in the bed, constantly looking to the left, why not twist your body to face them rather than turning to the left? Right? They're the smallest tweaks, but they can make a world of difference. So it's really
Absolutely.
just paying
Yeah.
attention to your body and what your body's telling you. So
And we don't do that,
oftentimes,
right? We don't do
yeah,
that. I mean, I until we feel the pain or until it's gotten so bad to the point where your body kind of gives out or you're like, "Oh my god, can't function," then we'll think about it. Um,
absolutely.
I myself have a long drive to work and I think so many people do, whether we're driving 40 minutes, 45 minutes, there and back or longer. Um, what are some changes we can make driving? Because sometimes I feel when I get to work, by the time I'm at work, I'm already like, you get out of your car and you're like, oh, it's hurting. I'm getting old. What are some changes we can make in the car?
Yeah. The ergonomics of driving, one of my favorite things.
Yeah,
The first one is, with the newer models, of course, over the past
right,
few years, you have electronic controls for your vertical cushion and your horizontal cushion. But then they also have the older cars where you have like that latch that you can lift
right.
up on the side. So if we talk about, for example, the electronic controls, you can actually control the horizontal seat to tilt down a little bit. So the rule of thumb I tell my clients is, as long as, if this is your back and this is your legs, the angle is more than 90 degrees, you're taking pressure off that lower back. If it's less than 90 degrees, not only are you putting stress on those hamstrings, but you're
Mm,
also putting a lot of tension in your lower back, and it creates you to slouch,
right.
right? So
Okay.
the thought that people usually have is, let's put a small pillow along my lower back, which is great, but you don't have to do that if you just tilt the horizontal cushion down a little bit. And you're just going to notice that your posture will go from slouch to more what should I say, squared
Yeah.
and less slouchy. And it's just how your posture automatically changes. Because the last thing we want to do while we're driving is think about our posture. We have to focus on the road. This makes it much easier. The other thing is with your neck and shoulder. The worst thing you can do, and I think we all know this, but some people still do it, is rest your arm on one steering wheel and you're just like tilted to the side. And,
Yeah.
you
Like
know, you
relax.
can just see
Yeah.
how this is causing tension in your lower back, but also your shoulder and neck. So, of course,
Right.
having yourself square is better than tilted to one side or the other. Um, the steering wheel, there's so many ways you can hold the steering wheel. I'm going to keep my hands up like this just because of how the you know screen is over here, but instead of having your a lot of times instead of having your hands up on the higher part of the steering wheel, you can go to the lower part of the steering wheel and just
Okay.
steer like this. What this does is it takes a lot of tension off your traps.
Interesting.
It also takes tension off your hands too. So there's so many little tweaks that you
Right.
can do to reduce the tension when driving, for example.
And we don't think about that. What about, I don't at least, but what about the vertical part of your chair? So I know you talked about the horizontal part. What, how do you know where to adjust your vertical part to, or the ideal positioning?
I would say pay attention to how your neck is feeling.
Okay.
If the vertical cushion is back too much, you can see how if you did that, you're kind of like slouching forward to look forward. And I we've all seen drivers where it's just so far back, like so, right? If you just have it a normal tension, normal like what should I say, angle, it will take pressure off your neck. So I would adjust it to whatever makes your neck feel
Neck feel good.
comfortable. Yeah.
Interesting.
But the main key with all of this is the actual horizontal chair going up and down,
Okay.
cushion
Got it.
going up and down. And that alone will straighten out your upper back too.
Interesting. Well, first
Yeah,
of all, I didn't know that the horizontal part of my chair moves. So I would like to state that and admit that. I'm sure many others
yeah,
don't know that. I always just focused on the vertical. I don't think I ever even thought about the horizontal part of the driving chair.
yeah,
So, I'm going to try that for sure.
yeah. And
Sometimes I feel like I'm going to work and then I'm coming home. Well, you're driving to work, you do your day, you're stressed out, whatever it is, the ergonomics, then you drive home. And then there's a lot at home as well, day to day. I don't know. I feel like I'm always bending, picking up things, picking my kids are young, picking up after my kids. I'm in the kitchen. So well, I also have to cook dinner right when I get home. So, like, what are some things that you feel we do wrong or things that you see every day that we're doing wrong in the kitchen?
one of the things would be being mindful of the center of gravity, right? So when we are doing, let's say, dishes or chopping up vegetables, for example, if this is our vertical body and we're slightly tilted forward a little bit with the upper back because we're leaning forward to work on whatever we are, whether it's dishes or vegetables,
Right.
the center of gravity has now shifted forward, and what ends up happening is we're putting all that pressure on the lower back and also neck and shoulders. So the one thing you can do is you can take like a half step back with one of your, if you're standing square, you can pick whatever foot you want, take a half step back. You'll be surprised how much of a difference that makes, because now it's like a teeter totter like this a little bit, rather than if I use this as an example as my waist instead of bending like this, now we've done this, right?
Right.
So we're straightening it out by just making a slight little tweak. um, that's one of the things you can do. Again, when it comes to working on something, in front of you, there's always going to be some level of strain, but we can do the
Right.
best thing we can to reduce as much as we can, right?
Right. And what about
Yeah.
like I find is there a best way to bend? Like I'm always bending. You know what? Let's just even talk about cleaning, right? Like I'm picking up a vacuum or mopping or whatever it is. We are slouched over. I feel all the time, and I find vacuuming very hard because I'm always slouched over, and it's a long you're doing it for a while. What is the best
Yeah.
way to? Is there an ideal way to do that?
Sure. Yeah. I'll first talk about bending. And this is more so what you can do if your lower back is stiff. Try to bend at your hips, not
Okay.
slouching your lower back down, but hinge at your hips. If you look at your baby, toddlers, they'll always bend at their hips and they can hinge down at their hips to pick something up instead of slouching down and curving your back the whole way, right? Another thing you can do is you can actually just and I'm going to use the example of if you currently have lower back pain and you don't want to make it worse, kneel down, right? To
Right.
to pick something up. So you're upright, you're kneeling down onto one knee, pick it up, and then come back up, right? These are different things you can do because if you are dealing with back pain, stiffness, the best way to get rid of it long term is to avoid movements that are further aggravating it when it's aggravated. Um, when it comes to vacuuming, what you can do to save your shoulder and lower back is waltz with it. If you can picture rocking back and forth, so it's hard to show on a podcast, but I'll
Yes,
try to
absolutely. Yeah, no,
explain
no.
it. If you're
Yeah,
on if you have one leg back and you're just like waltzing back and forth,
right.
what's happening there is not only
The
are you getting a
teeter-totter
lower
back and
body,
forth.
yeah, not only are you getting a
Yeah,
lower body workout, but you're moving the vacuum cleaner
right.
forward and back too, instead of this and this with your shoulder and killing your shoulder the whole time. What this is going to do is
That's
it's
what I
going to
do.
save your back. It'll save your back, your shoulder, and neck as well. All you're doing is just waltzing with your legs back and forth and switch legs because whatever you do on one side, you want to do on the other. But you'll notice it's such an easier way of vacuuming, for example, without feeling those strains on
Right,
your
because
body.
after we vacuum, I don't know if it's just me, but everybody feels tired, right? Or you feel like, ah, my back is hurting. I got to sit down, right? I've always felt
Yeah,
like that. I don't think that, like,
yeah,
that's just because it's that constant repetitive, hunched over and arm motion, right? So you just feel
right.
that strain.
Yeah,
Um, for sleep is the most important thing I want to say in our life.
yeah.
So how can we make sleep better? Sometimes I hear of people sleeping with a pillow between their knees or legs, or I don't know, I get mixed messages whether I can sleep on my tummy because that's what I do, or it's better to sleep on your back, your side. So what is the sort of ideal position for someone having back pain, I want to say, to sleep in?
Okay. There's two great positions you can use for if we're talking about lower back, for example. One is laying on your back, and some people do have difficulty with that, but let's talk about laying on our back if you're able to sleep on your back with no problem, and just putting a pillow or two underneath your knees. What that will do is take pressure off your lower back as well and just allow it to relax. Um, you have to think about what your mattress is like as well. If your mattress is one that's a little bit older and you'll notice that there's a dip in the mattress, I always say pump the mattress and feel in different areas. And almost always, if you've had a mattress that's
Yeah.
5+ years, uh, it will dip right where your hips are. And you'll be like, wow, that's
Okay.
such a difference. What you can do is whether you're laying on your side or on your back, take the thinnest pillow you have that you wouldn't use for your neck because you love your neck and place it along that hip. What that'll do is it'll just slightly raise the hip up while you're sleeping, whether it's on your side or on your back. And you all of a sudden now you're going to feel like your mattress feels new. It's not dipping anymore. So therefore we're removing that aspect. So I would put, depending on whether your mattress is a new mattress or on the firm side, you don't have to if it's a new and firm, but if you find that it's okay, maybe it's time to
Right.
replace it soon, that small pillow underneath your back and then put a pillow or two underneath your knees, you'll have a
Interesting.
great comfortable sleep. For side position, that same thin pillow along the hip that you're laying on will also help, offset any dip in the mattress. Again, if it's new and it's pretty firm, you won't need that there. But if there's a dip, that's what you can do. And put a pillow between your knees. By putting a pillow between your knees, you're aligning your hips and it takes pressure off of your spinal joints. And you'll know
Mm,
it's working for you in both positions or in anything you're doing. You'll know that your body likes it when it alleviates pain. Your body communicates with you through pain and different sensations. So if you're laying in these positions and feel, wow, I don't feel any pain, you'll know it's good for you because you're not feeling pain.
right.
Yeah.
Right.
And hey, it
And what
may
about
take a
sleeping on
few
your
days.
tummy? What about
On your
sleeping on your
stomach,
tummy? Yeah, is
you
it
know,
bad?
I think we've all heard that they say avoid sleeping on your tummy,
Yeah.
but I honestly don't think it's much of a problem. I don't.
Oh, really?
It's
Okay.
how you sleep on your stomach, right? I'm going to talk about the shoulders and neck first. Some people put both arms up like this and then they twist to the side, which is just wreaking havoc on your neck because both arms are up. But if you take one down and you sleep like so, what's happening is your torso also rotates a little bit. So now you're not torquing your neck to the complete end range, you know? You've now
Right.
twisted yourself like this. And if we're talking about this hand here, the same leg will also kind of, I wish I could show you my legs, but you know, be up,
Yeah. Yeah.
bent on the side. So it's almost like a situation like this or like this. And what I like about it is when you're in this position, you get to passively stretch out your neck and that shoulder region. And then when you switch to the other side, it's a great passive stretch for your neck. With the lower back, again, we'll talk about the mattress and how much give there is. If there's too much give, now you're gonna, if this is the front of your back and this is the back of your back, now you're going to hyperextend, right? And therefore, if you're hyperextending, you're putting more pressure on that lower back. And most likely, you're just going to feel it right away if that's an issue. The quick fix for it is that same thin pillow you're going to place along your stomach and
Uh,
upper part of your pelvis. And again, it gets rid of that dipping mattress situation by just leveling it out. And you'll notice it'll take a lot of pressure off your lower back.
wow. So, a lot of the lower back pain that's kind of sitting with us for a while, I think, I guess it starts to get inflamed. Your, joints, I want to say. I'm probably
Yeah.
going to say all the wrong
Yeah,
terms. But you know, uh, are there dietary changes that could flare this pain up? Sorry, are there certain foods that we're eating a lot of that could flare this pain up because of inflammation? Um, that we can make changes.
absolutely, absolutely. And it's so true. We are what we eat, and our body reacts to it. You know, there's many studies that are starting to say that, for example, your gut is your actual brain, and this is our secondary brain because there's 9 times
Wow.
more nerves going down to the gut area and sending information up than going straight up one nerve, right? So, sorry, it's the other way around. There's 9 times the nerves come are sending information upwards to the brain to process what we've eaten. It can affect our mental health. It can affect our joints, like you're saying as well. So some of the common things that will do that is sugar. If you just
Yeah.
remind yourself, in moderation, sugar is the devil,
Right.
and it creates a lot of inflammation throughout the body and the joints. Nightshade vegetables is a big one too. Nightshade vegetables, a big culprit is tomatoes, for example. Not everybody has this reaction, but some people are more sensitive to other foods, right? Um, high salt intake can also create inflammation as well. What I would suggest is if you're interested in this, anybody listening, Google anti inflammation causing foods and you get a
Right.
whole list of it. And it's not just processed foods, obviously, is a huge thing. There's a lot of chemicals and additives that are put in foods that can uh, flare up your arthritis in your hands. If you have stiff hips, lower back, you're going to feel it more as well. So you'll get a great list that way, and you can see if this is something that's happening. Test out those foods and say, how
Right.
do I feel after I eat these certain foods? And if it does cause that, now you know what foods you want to kind of eliminate and see how you feel with that.
Right. You know,
Yeah.
yeah, foods are a big thing, I guess, for, with inflammation. Now, like a big popular, thing coming out is red light therapy, helping to decrease that inflammation. I want to say. So, is that something that you would recommend for, I guess, backs, or other areas? Do you guys talk a lot about red light therapy?
Red light therapy is becoming more and more popular. Whether it's skincare, we use it for
Mhm.
so many things, but for healthcare practitioners like chiropractors, physiotherapists, anybody that's a physical therapist working on alleviating pain, sorry, red light therapy works really well because what it does is it activates the mitochondria in cells, which is the powerhouse of the cell, to help regenerate energy in that cell, which then helps to accelerate the healing of that tissue. If we have an area of inflammation, it's great for that. What else it does is it improves the blood circulation to the area. And as we know, the blood carries all the nutrients to that area of injury to help reduce it. I find that it works really well for joint pain. I use it on my patients that are dealing with disc issues, which is that sciatica running down the leg. It can happen in the neck or lower back. If it's the neck, it's the hands. If it's the lower back, it goes down to the legs. So it's a powerful anti-inflammatory, and it's very non-invasive. So the only contraindications really for it is you wouldn't put it on a cancerous lesion that's on your skin,
Okay.
because it may help grow it, right?
Hmm.
If you have metal implants put into a joint or area of your body that you've broken, and they put steel rods and screws in there, uh, you refrain from that because that can heat up the material underneath. And then, of course, you wouldn't put it on a pregnant woman's stomach right above the fetus, just because
Right.
they're very fragile at that time. But otherwise, it's a very safe, non-invasive form of treatment, and uh, I highly recommend it to my patients.
I love that. I love that. That's so great. One quote that I saw of yours is "You're only as old as you feel," and I love that you said that. And
Yeah,
so true, right? I mean,
yeah,
I guess age is a number, but if we start working on our wellness, our well being, how we feel, we won't feel that old then. So
that's right.
that's so
That's
great.
right.
I love that.
Yeah. Just like I mentioned earlier in this podcast, is we in this physical vessel that's been given to us, and it's our responsibility to take care of it, whether it's doing physical therapy, exercise, stretching, watching what we eat, because if we don't, we're going to suffer the consequences. And one of the common questions I ask my clients is, what's your biological age versus your chronological age, right? Your chronological age is your assigned age because of your birth date. But we all know somebody that will use their age as an excuse. I'm like, oh, I'm too old for that. I'm too old to go on walks. And then this begins this like downward trajectory of health over time. And we see it a lot
Yeah.
with our retirees as well, who now, for example, may not have that purpose in life that they did when they were working. And now they're trying to figure out, what am I
Yeah.
going to do? But if they don't keep themselves active and find things of joy, it will start to go downhill for them. And when I ask my patients what the biological age is, it's the age that you feel now, physically and mentally, in this physical vessel that you live in. I mean, for me, I'm 43 right now. I can say I feel about
You look
35.
so good.
Thank
Yeah.
you.
Wow.
Thank you. I
You can
appreciate
say
it.
that.
Thank you.
Wow.
And it's just how you feel, right?
Wow.
Whether it's changing how we
And to
eat.
say that is huge,
Yeah.
right?
Yeah.
Like, I don't think there's many of us out there that can say that.
Yeah.
Most of us will say we are this age, but we feel older,
Right.
right?
Right. I truly believe that you can reduce your biological age by taking care of yourself. Right. Especially if
Yeah.
you're downhill, are dealing with ailments. If you just change your diet, figure out, go see a naturopathic doctor, go see a dietitian, somebody who can help you fix your eating habits. That's the first step, and you'll notice a huge difference. Exercising, stretching, go get a massage, go see your chiropractor, any physical therapist that can help you with your current ailments or give you back flexibility and functionality. And you're going to notice that you're going to feel much better over time. We just have to pay attention to our bodies, right? So,
I love that. And that's one of the things that I know I reached out to you because I love that you're a chiropractor and there's passion there, but you're so passionate about actually wanting to change people's lives, the way they feel, their age, and how they're living their life. And that's huge. So
thank you.
thank you, Dr. Sabharwal, for all your insight today.
Thank you.
Super helpful. Tell us, there's so many people listening that I'm sure want to be able to reach out to you.
Sure.
Tell us how they can find you.
Absolutely. So one of the main ways to find us is Our website is www.mychiro, mobility, so all one word, mychiromobility.com. You can find me on Instagram or TikTok. It's at my.chiro.mobility. And there, what I do now is I share everyday tips and tricks on how to, whether it's the perfect stretch for your neck or little ergonomics that maybe we're thinking about. How are we holding our phones? How can you hold your baby a little bit better? How can we change the monitors, to, alleviate neck pain? These little tidbits can start the process of reducing daily aches and pains and prevent injury.
I love that. Thank you so much, Dr.
Thanks
Sabharwal,
for
for your
having
time
me.
today.
This was great.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.